There's a myth that maybe it would be helpful if we talked about, and that's the financial side of this, and not to get into all the billing aspects because each, I think, area of the country has their own way of billing certain point of care testing. But, the financial side of this is that this is a test that is needed to be a standard of care within your dry eye package or arsenal, if you will. And, getting into this and getting it into your practice is as simple as buying the diagnostic test and having them in place. And that's a minimal cost to put out and to have in place. And, the billing out of it, you can work with Quidel, you can work with reps, different people have ways of helping you with that. But did you see that at all as a stumbling block? Because I feel like sometimes at Dry Eye University, people think it's impossible. I need machines and labs and all these different things to be able to do this. And it's just not like that. It's so simple.
I love that concept of MMP9 mythbusters. And I think you're completely right. I think for clinicians who are new and practices who are new into the dry eye entry space, it can be really overwhelming. But really, it's as simple as starting with your advanced diagnostics. Know what you're treating. Get your MMP9 test. Get some osmolarity. It's part of the ASCRS preoperative algorithm guidelines. It's much more sensitive, specific, and accurate than your traditional dry eye metrics, such as Schirmer's and staining. So do those things as well, but it's not expensive to bring on these tests, such as MMP9, that really tell you a lot about what's going on the ocular surface.
And actually, MMP9 with Quidel, I think, is one of the most inexpensive diagnostics to add to your dry eye diagnostic set.
I agree. You've got your standard photography, your standard topography. Those things are, amortized out for low cost, but as far as like an accurate snapshot of the vital signs of the ocular surface, that MMP9 tells you is invaluable.
Right, super easy.
Super easy.